The SOUL study, SOUL stands for stent omission after ureteroscopy and lithotripsy, and it is a large, combined, randomized and observational clinical trial assessing stent omission versus stent placement after ureteroscopy for kidney stones. It is one of the largest studies funded by a federal agency in kidney stone surgery to date. It's quite a unique clinical trial developed with patients, funded by the Patient-Centered Outcomes Research Institute, performed in a statewide surgical collaborative called MUSIC, and MUSIC is supported by Blue Cross Blue Shield of Michigan. So it's a very unique trial where it's a partnership between patients, doctors, a funding agency, and an insurance company that funds the collaborative. When the trial was submitted for a grant review at PCORI, and it goes through an independent review process that's very rigorous, one of the peer reviewer comments was that this trial, if it is successful, could change the field of urology. And so that's the impact we're hoping for, because right now it is routine practice to stent patients constantly after ureteroscopy. And stenting has so many problems for patients. If we could avoid that, that would be a real game changer. And what we need is a really well done clinical trial assessing this. So our goal is that we create the evidence that enables us to make those changes in patient care, in surgeon behavior and modifications, and to change care nationally and internationally.
The PKIDS trial was an observational trial conducted at 30 medical centers in the United States and Canada. The goal of the trial was to strengthen the evidence base for the surgical management of pediatric patients with kidney stones. The reason for this is that the evidence base currently is incredibly weak, so that we don't have important information to share with patients so that they can make the best decisions for which choice of surgery is the best for them. I think it's important to state what is known now. So the current AUA guidelines, which go back to 2016, demonstrated that there is equal recommendations for ureteroscopy and shockwave lithotripsy for stones under 20 millimeters. And despite the equal weight of those recommendations and the weakness of that evidence base, about 80% of children receive ureteroscopy for these stones. What we found was for children with kidney and ureteral stones, shockwave lithotripsy and ureteroscopy had equal stone clearance. There was no difference. But when you look at these patient-reported outcomes, shockwave lithotripsy compared to ureteroscopy had better urinary symptoms, less pain intensity, less pain interference 1 week after surgery, after you adjust for all of the preoperative symptoms. The goal of PKIDS is not just to generate evidence, it's to take that evidence and apply it back into clinical care to directly improve outcomes. And because this did reflect a broad spectrum of children with kidney stone disease, those results should be generalizable, not only to the United States, but presumably outside, any place where children receive these treatments.